So welcome everyone to the final session. First, I would like to thank a lot of folks. First, our sponsors, our session moderators who have just done an incredible job keeping things on track and summarizing all of the discussions, which we'll hear in just a moment. I'd especially like to thank the breakout moderators and the recorders for working with you to get those valuable opinions, the panelists and all of the work that they did before and during the meeting, and for Dr. Kubiak for helping lead us through that effort. And especially our participants. This is great to have so many of you staying right to the very end of the meeting for this piece. I'd also like to thank our online participants because many of them joined very early in the morning, very late at night, or perhaps even in the middle of the night. So really great to have the online contributions, and thanks to Carmen Youngbeck for bringing their issues forward. A hallmark of IABS meetings is to include a meeting report, publish a meeting report, including recommendations and conclusions. So today is just the start of that process. We will be, the session chairs will be summarizing their sessions, and then we have a summary of the conclusions, which we will go through fairly quickly to try to keep on schedule as best we can. To me, it seems like we've had a lot of discussions this week about a pool and standing on the edge of the pool and leaping into the pool. And it certainly feels to me like we've at least dipped our toe in the water. And next we need to step back and look where we go from here. So that's the discussion today. The format of this will be a listing of recommendations and conclusions that you all get a chance to read and comment on. So the process is that this group, along with the steering committee and our writer, will refine the list of conclusions over the next 10 days or so, and then you all the participants will receive them and have the opportunity to comment. So if we have time, if you see some things that are really critical that you need to alert us to and point us out, great. Otherwise, you will have an opportunity to provide written comments, and adjustments will be made accordingly. My job will be timekeeper to keep us on track and close to our ending time. And with that, we'll have brief presentations by each of the four moderators. Session one was setting the stage. Dr. DeWitt.
Well, I think after the opening by our president, Dr. Rick Hill, Dr. Eloa from OWOA expressed or underlined the presence of the updated manual that gives us the opportunity to vaccinate and trade at the same time. And Dr. Dinga from the FAO underlined the importance of poultry and the products for, well, first as food and a source of income for many, many countries worldwide, including a lot of people in countries have low incomes. Then the keynote by Dr. Swain. Well, basically in the past, we had the old-fashioned situation in which the low path mutated into poultry, sometimes into high path. And then we had an outbreak. If in that situation, we killed the infected birds, normally we also eradicated the field strain. So they were rare occasions of limited size, also in time. Now we have the H5 goose Guangdong viruses, which are now endemic in many, many species of wild, domestic, and migratory birds in a big part of the world: Asia, Africa, Middle East, Europe, and North America. So this is we can consider as a game changer. So this results in more and higher and bigger outbreaks, and not only in poultry, but also in humans, in non-human mammals, bigger areas. We have more reassorted viruses, and our losses have are more or less exploded in size. So I guess we can say that despite many, many people pay more attention to biosecurity than ever before, biosecurity alone cannot do it anymore. And for that, vaccination can be a valuable additional tool to our fight against the H5 viruses. And for that, it's also very important to realize that we have major changes in the past 25 years. We have much, much better diagnostic tools. We have much more many more kinds of also modern vaccines that also include the possibility for DIVA, also induce cellular immunity, which makes the vaccine on average better and broader. We also have better abilities to kill and depopulate. So on that point, we have a lot of much better tools than we had in the past. So I guess in present, I think we can conclude that in many parts of the world, or at least many people will not consider the present situation as sustainable anymore. And I guess that H5 will not adapt to us. So we will have to adapt to the H5 situation. And for that, there can be a lot of barriers which are partly real, partly are not real, but for any barrier, there is a solution. So let's start to use them.
Thank you. I think session one set the stage very well, and thank you for that concise summary. Dr. Swain, session two, preventive vaccination where virus is not endemic and a wish to maintain freedom from infection.
Great, thank you, Dr. Hill. We had some excellent presentations yesterday to kind of set the stage of what was going to be our panel discussion. And I'll just kind of review some of the highlights that are the large ones. One is that some vaccination barriers we know are real and they're all solvable. There are some barriers that are overemphasized that either are not really a barrier, an overinterpretation or misinterpretation of information. Silent infections occur rarely in flocks using well-matched vaccines and that are appropriately applied. Well-vaccinated flocks have reduced risk of spread. They do need to have monitoring of their antibody. Of course, that's primarily done by the HI test currently to confirm success of that vaccination and a predictability of protection in the field. We know that routine dead bird testing or potentially environmental samples will help us find that virus in vaccinated flocks as well as non-vaccinated flocks, so appropriate actions can be taken. We need ways to update seed strains, including live vectored vaccine with a cassette concept. Many countries already have that in place for non-replicating vaccines, and the next step would be to extend that concept to multiple other countries, and then also include possible more rapid ways of updating live vectored vaccines. We know from the talk by Etienne Bonbon that vaccination does not affect the HPAI status if adequate surveillance is conducted. We also have vaccines used as an additional tool to biosecurity, but we do need flexibility on which vaccines to use and how to apply those vaccines in the field. We need to engage the biologics industry to bring new products to market, especially, I think, identified throughout these 2 days of mass applied vaccines, which we currently have a very limited number of countries and limited number of those types of vaccines. We need a combination of both passive and active surveillance systems with targeted sampling, for example, environmental samples and bucket sampling, and that's much better than the random sampling that can be done for a case of clinically normal birds. We need to really target that sampling. And we know there's positive public health aspects of the poultry vaccination. And we've seen this in multiple countries that do practice it, a decrease in human HPAI cases. And we learned also the expectations there's going to be no increase in risk of the viruses to infect humans from those vaccinated poultry.
Thank you so much. Day two was busy, and I'd like to thank the speakers for all of their presentations. And as you can see, we already are beginning to have our list of recommendations and conclusions and needs to move forward. Session 3 earlier this morning, vaccines for outbreak control in non-endemic areas with the goal of regaining freedom. Dr. Sims.
Thank you for that. I haven't got a presentation for this particular slide because I've been working on the main recommendations and conclusions for the meeting, which you'll see shortly. But very briefly, the session we had this morning, we had Carol talking about the importance of having the whole of the industry involved in vaccination programs. We had Dr. Stageman giving us information about how an imperfect vaccine can still work to eliminate virus, and also a lot of very useful information about the way we may not have evolved our control programs where we should have, given we're using the same methods that we used 300 years ago for control of disease. We had some discussion on trade issues with the WTO, and also Ian providing us information on some blue sky about what might be available in the future for vaccination. But there's this gap at the moment where we have a lot of these studies are happening, but they're not going beyond those studies. And there may well be some technologies we're not yet harnessing and using properly. And I think there's an area which is a weakness there. That then went into the panel discussions and sessions, which involved a very specific scenario of emergency vaccination. And there's been some very, very good panel answer breakout group discussions on that. Where again, the issues of trade came up again and again, but also some of the factors about doing emergency vaccination. You can't do that unless you have a plan, you have vaccine to do it. But we'll go into some of these issues when we go through the further conclusions and recommendations for the meeting. And over to Ian, who's doing the last session.
Thank you. Session 4, which you've just heard, vaccination in endemic areas. And Dr. Brown will give us a quick summary.
It will be a quick summary, and it's all fresh in your mind, so it shouldn't take too long. So naturally, I don't have a slide to put up there, but the information will be available. So we had 4 presentations from countries that have endemic infection with high path viruses or low path viruses, and have been vaccinating for most of them for some period of time. So China probably got the biggest experience over 20 years in their commercial sector. They have a formal system for surveillance, they review vaccine match, and they make updates to try and get ahead of the virus. We then heard from Latin America. It's a very complicated landscape. There are H5N2, H7N3 viruses. The biggest experience, of course, is in Mexico, where they're using a range of different vaccines. But it's recognized that surveillance generally across the region is weak. So there are countries there vaccinating, but not really tracking and doing surveillance. And I think the message I took away from there, given the current risk and threat, is that there's probably a lot of work to be done and proper resourcing if they're going to be able to respond to a new threat from H5N1 clade 2.3.4b, noting things like basic procedures of disposal and depopulation were probably not well defined in some of those countries. In Indonesia, there's a lot of experience going back many years, and it's really pleasing to see, I think, that they've really developed a great monitoring system. They've got a formal ability to make decisions about where they vaccinate, which sectors, what vaccines they're using. They're focused on 2 clades of H5, and they've also got an H9N2 problem. Vaccination is at producer's cost in sectors 1 to 3. But, I think this formal system, quite similar to what has been developed in China, they have in place. So they are tracking and updating vaccines. And then lastly, we heard from Egypt, where again, there's an extensive experience. There are multiple vaccines. There is a lot of virus diversity in H5 there. And they've got more than 1 clade. And there is detection and surveillance. It's not entirely clear there's such a structured system in the vaccinated populations, but there is the assembly, shall we say, of reviewing strains. But maybe the vaccine updates are not particularly timely. So there's still work to be done there, and there's a lot of vaccines being used, and they've got variable outcomes in commercial birds. So that's a rapid tour, I think, of session 4.
Excellent. Thank you. I think altogether, those 4 summaries really provide the context and the information that came from our speakers. Next up, Dr. Sims will help lead us through what we heard from you. And we recognize that this is a work in progress. You will have, as I said, you will have an opportunity to comment on this and react to it a little bit today. There will be disparate opinions in here, and when there are such, we'll try to reflect that those have both were presented at the meeting. And with that, Les, we'll let you walk us through, and then I'm sure the other moderators will jump in as needed.
Thanks, Rick. What we've got here is essentially a combination of what we saw as some of the key points that have come out of the meeting, which includes the information from you, but also from the panels, from the speakers. It's really a conglomerate of what we saw as the key points. Now, what was to me was amazing about this meeting was how much information came out during the meeting. So we are going to have missed some of the things which you consider important points. So when you get the chance to see these conclusions, if you see something we've missed or you think should be in there, please let us know. But we've tried to select some of the ones which we think are most important. I've already, in my head, I have several I think we probably should include, but that's the process we're going through now. And you will see a revised version of this list in the next 10 days or so. But bear with me, we'll go through this and I'll share this with my colleagues who will also do it page by page. So I think the critical thing is that the cost of HPAI are huge. We are dealing with a disease which is causing massive damage, both for affected farms and communities. And we need additional measures to control HPI better, given the extent of infection in wild birds, the evidence of increased outbreaks, and the large numbers of birds that have been destroyed as a result of avian influenza. And vaccination is a tool that can be used to add an extra layer of protection that reduces the quantity of circulating virus and the number of farms which we have to stamp out. But there's still reluctance to deploy it in some countries. And those concerns, especially in high income countries, is all about trade and concerns that if we introduce vaccination, there's going to be problems with then trying to sell your birds to places who will not accept the birds because the vaccine is being used. And of course, these trade concerns are inextricably linked with having an appropriate surveillance program in place. And those systems can be produced, but finding one which trading partners will be happy with is something which is an area we have to keep working on to make sure that we can convince trading partners that's the case. But even if we have an appropriate surveillance system, there may well be some situations where trade will be inhibited. And if that's the case, then we're going to have trouble introducing vaccination. I'm going to pass to David to do the next page.
So we had some discussions, especially today, about appropriate systems for surveillance that have to be developed. We don't have a single system that fits all, but what we have to design as countries is cost-effective programs. Now we do have this knowledge gap about the types of samples, the number of samples, and the role that we may be able to use more environmental sampling as opposed to birds themselves. But all those are things that can be solved. We know that around the world in multiple countries that routine dead bird testing has been very successful in non-vaccinated flocks. I think we're convinced that it could be a huge component in vaccinated flocks, as has been used in some other countries. The capacity for the surveillance programs must be available and will likely require use of accredited private labs. There's really not enough manpower, probably in government laboratories, to do all of that, especially when you combine monitoring of the effective vaccination by serological testing. Then on top of that, the surveillance looking for the wild type virus. We need to consider any adverse impact of these large scale stamping out that we're doing right now with the cases, and try to look at, are there alternative approaches to reduce the reliance on this method? And of course, vaccination is one of those that should reduce the number of outbreak cases that would then eliminate much of that stamping out. We also know that from Richard Webby's talk that vaccination is not a threat to public health. In fact, it helps to protect humans from infection. And as our colleagues have shown in this last session, that at the implementation of the vaccination program, the human cases declined rapidly because there was less exposure, and there's no evidence that the vaccination would change the virus such that the virus is more infectious or deadly for humans.
Use of vaccines does not alter the avian influenza status from the trade perspective. If you look at the current version of the terrestrial code, a limited number of vaccines is available for use in the EU and USA at present, and it but will become available if companies identify a viable market for these products. So basically, they are waiting for our signal that there will be a market that they can work on. Most currently available vaccines in the EU and USA are injectable products and DIVA compatible. Vaccination would be added if a safe product could be developed incapable of reassortment or reaversion to virulence that can be delivered by mass application. Certainly, if you talk about emergency vaccination, that's a real must. Even influenza vaccination programs, if introduced, need to be fit in the other existing vaccination programs.
Okay, true silent infection with no birds dying from disease in well-vaccinated flocks almost certainly occurs rarely, given few vaccinated flocks are 100% immune. So we heard Leslie's thoughts on that yesterday. The odd dead bird. We're not saying that could not happen, but it would be minor. Serological DIVA testing will be part of part of the surveillance program. But we know there's some limitations, and these need to be recognized where other influenza viruses in particular are circulating that might complicate the interpretation. If emergency vaccination is to be used, then a vaccine bank as an alternative for rapidly acquiring vaccine is absolutely required. I think we recognize that would be a major limitation to stand up capacity required at no notice. Vaccination in a number of countries where the virus is endemic and have programs in place for mapping the characterization and updating of those vaccines. Antigenic variants can be imported to countries where viruses are not endemic. And we need to be mindful and cognizant of that. And that vaccines that are a poor match to circulating strains should not be used.
So what we've tried to do from here is to come up with a few recommendations from the meeting. Now, none of these are binding. They're just thoughts that we have, that things that we believe should go forward from this meeting. So we'll go through these, and some of these have come directly from the meeting. So, for example, the first one is about something we had come up in the first part of the first day, was that there is a strong case to produce get the formation of a consultative committee on vaccination involving a range of stakeholders and supported or perhaps managed by FAO, WA and WHO, which would provide support to greater usage of vaccination in association with other control measures. Now, this to me is a really important step to try and get in place. It will help us to continue the momentum of what we've developed in this meeting to try and push things forward. Again, it is just a recommendation for consideration, but I believe it would help to get things moving. The second one is, and we made the comment that it's possible that we should be doing some vaccination on a small scale. Let's get started. And what I'm concerned about is if we just try and get someone to leap off the cliff into the pond now, it's going to take years for that to happen. So let's try and start slowly and get at least something moving. And we hope that our recommendation would be to implement trial vaccination in the field in multiple countries that are not currently using vaccines. And this would happen once the current laboratory tests on vaccines are being completed in the EU. So if we have multiple countries doing it, we have less pressure on a single country. You can't be singled out as being the country doing this work. But it gives us a starting point to see how vaccines can work. So the farms in these small pilot trials would be closely monitored to demonstrate response to vaccination, freedom from infection, and to assess issues such as suitability of different vaccines for different types of birds, and also cost issues associated with vaccination. If we're doing these trials, these are not challenge trials in the field. They will be field vaccinated birds, and there's every chance they won't actually be exposed to virus, but they might. But we can use that. The thing is, we can use the birds as an opportunity to assess and develop appropriate surveillance programs by taking the birds from those and then taking them into a laboratory situation to mimic a farm situation, to see what happens, what sort of environmental samples work. I mean, some of this work's been done before, but we haven't done enough of this to establish what are the most appropriate samples to take for environmental sampling. So if we can get these trials going, we can learn more about this under a more controlled condition, and that will help to answer some of the gap or fill some of the gaps we have in terms of knowledge. And there's a number of laboratories can do this work, but they will, the likes of David's lab, Ian's lab, Tim's lab, all of which have got the capacity to do this sort of work. And I think it's important this goes ahead. I think the beauty of this meeting, it's created some momentum, and everyone in this room now has an obligation, I believe, to try and keep that momentum going. So to continue to promote the value and importance of vaccination, just building on the momentum we've gained already in this meeting.
So also just launched recently, it's through OFFLU, which is the Animal Influenza Expert Network, is the AIM program. And that program will then be dealing with individual laboratories that are members in looking at isolates from poultry and wild birds, and then providing genetic material from these new isolates for analysis and sharing of that information to help across a global area of what vaccines may be of value in protecting against the viruses that have emerged in the field. Countries where infection is endemic will continue to look at ways to reduce their likelihood of vaccinated flocks being infected, including changes in the manner in which birds are reared and those birds are sold. Like compartments. So that's kind of, and we just kind of had a similar discussion earlier today about that. Translational research is a real critical need. I think all of us in research on vaccines know that it's really easy to get funds to do that first development concept of an idea, but once we do that, it tends to fall off as far as translating that laboratory research and move that on into vaccine studies and on into commercial products. So that's an area that needs additional work, is to flesh out those vaccine technologies and see which ones can be feasible and move into commercial operation.
So we've kept our list of recommendations short. If we have a long list, then we'll run into problems. But there is obviously scope for more, and I already have yes, question from.
Thank you. Yeah, we'll take a couple of moments to get some interventions from the audience.
Thank you, Rick. If you could come back just one slide, yes. Regarding the consultation process, I winced a bit at it because I think asking the Three Sisters to form a secretariat or form a support group is going to be extremely heavy. They don't have the resources simply to help us there. And from an administrative burden point of view for them, it's going to take a long time to agree on that. Could we modify slightly this by agreeing that we need a consultative process that involves the Three Sisters, IGOs, interested party stakeholders, and member states? Because the real engine of change will be the countries. It will not be the Three Sisters. So I'd like this to be changed, and in a way that is a bit more vague, but leaves, I think, more room for being quick and practical. Thank you.
Thank you very much. Yes, please.
Yeah, I had that point as well, and we didn't even consult, but so I'll make my two additional points. So I think one of the things that came up a lot in session 1 and 2 was, and I think it needs to be reflected somewhere, is the questions about continued public societal acceptance of culling at the levels we're doing and increasing levels, and whether that's a given. And I would say, I'd add to that comma, especially in the future when there will be vaccines available, because we'll then have a different situation. So I think that's an aspect that needs to be looked at. My second point was made, and I think another point that's important, and I must admit this maybe didn't come up in the formal meeting, but it certainly came up in lots of conversations I had. So I'm giving it a go to see if I can get it in there. I think we need to have a forward-looking scenario on how AI is going to spread. That's crystal balling. It's impossible to do, I know. But for political purposes, you do need to have some sort of scenario looking forward. And what have we seen over the last few years? And what are the likely scenarios of how this will spread? And most importantly, what's the impact of that in terms of, money, chickens, et cetera, and stuff like that? It's a scenario looking forward. And I think you might need that in order to convince people for the need of vaccination. Thank you.
Thank you. Yes, please.
Yes, bouncing on Olivier's comments on this point, I agree. We need not reinvent the wheel. There is a GFTADS global policy and global strategy on avian influenza, and so maybe we can request them to work on the vaccination sera, but we can dissociate this consultation committee and include the GFTADS there.
Yeah. And that was, I didn't include GFTADS to try to be vaguer than I might have been, but we certainly had discussions on GFTADS being involved in this and the strategy being part of that whole process. I mean, vaccination has to be a huge component of that strategy.
Just a question. What came up from the trade partners was that what is adequate testing? Now, surely we as scientists, we know enough about what AI does to different turkeys and layers, and there are specialists that we can draw on. They can tell us that to adequately find AI in a layer bird do this, turkeys do that. So it seems like we're reinventing the wheel. But if we got together, or the panel got together, or the world got together and said, listen, this is what we consider adequate from a world perspective as a body. We're saying this is what we consider adequate to test for AI in a vaccinated flock, in layers or turkeys or broilers. This is adequate. And as a body, surely we should be saying, this is what we consider adequate. What are your concerns with our adequate testing, if I can put it that way? Otherwise, we constantly say, give me something adequate. But there's no world authority besides ourselves that should be doing that.
Okay, thank you.
Great comment. And again, we have considered that we haven't put in there yet, but we can certainly consider that. I would see the consultative committee playing a major role in that they would be the one, they could be helping to come up with these things. I mean, there's still some gaps in our knowledge on what is an appropriate system for vaccinated birds, because we haven't had many cases where we've had breakdowns in flocks I mean, you may well have done it with your H6 stuff, but
well, I'm sorry to break in, Les, but the point I make is that we've got vaccine companies that are doing all these trials with their vaccines, and they are doing extensive work to establish what happens in those birds. Surely we should be drawing on their experience and saying, what did you do and what do you see? Because they're the ones we're going to question and say, we're going to use your product and it failed, and they're going to say, yeah, but you didn't use our guidelines. So surely we should be putting some of the ball back on them. I'm just throwing it out for a comment.
Thank you. These are exactly the types of comments that I think the panel was hoping for. Anything that we can do to improve the message, clarify the sentiment, and add to it. So we really appreciate your input. Please join me in thanking them for an incredible job this week and helping keeping everything on track. I don't know when they sleep to get all of this information together. So final word from the panel, and then we'll have a word regarding the survey for the meeting.
I just again like to thank all the participants. I mean, as being part of the scientific committee for this meeting, my hope was we would get the sort of feedback from you that we've had, and I've been blown away and really humbled by what's happened here. So thank you so much.
And I think, one of the important points is that the people that are here are the ones that are concerned about this issue and want to see it succeed. And it's encouraging for me to see that it's a broad representation of experts across multiple countries, a different expertise, I think with different points of view, and that makes it a rich output. And with that type of information, those type of people, that type of background, that makes the chances much, much greater that we'll succeed. And it's not us us on the front that's succeeding. It's the people out there and who you represent that will succeed.
I don't know if I will have grandchildren. I have children, but not yet grandchildren. I really hope that I can explain them later that I was part of a historical meeting, this one. Thank you.
You stole my words there, Jack. So I ditto my colleagues' comments and just say it would be nice to think that we can look back in 5 years' time and say this meeting was the turning point in solving this, and the collective mass in this room, the ideas, means that this is not beyond our wit to solve. So, but we need to keep the momentum.
So now we have a request, another request for you for additional input. This was somewhat unique in the way we styled this meeting and planned the breakouts and tried to capture your thoughts. So as part of that, we have a survey for you, and Maddie Cox will help explain the process and somewhat of the next steps from an administrative perspective.
Thank you very much. So you're going to see the first slide again in a few seconds. It's a survey. We would really like to have your feedback about the meeting. You can use your phone, the camera of your phone, and scan the QR code that you're going to see very soon. Or we will send you an email with the link, and we would be very grateful if you could answer that. Regarding the slides and the access to the replay of this meeting, it will be accessible early next week. We will send you again an email with the details on how to connect, because it's a dedicated space only for the participants to this meeting. Thank you very much.
One last thank you, which is a thank you to the International Alliance of Biological Standardization and all the officers, from Maddie and her staff who really pulled this together, Carmen and others out in the audience. This would not have been successful if there hadn't been this organizational oversight and the people dedicated to make this happen. So thank you very much.
The final word then is to formally adjourn and wish you safe travels home, and thank you again for a wonderful couple of days. Meeting adjourned.